This segment is to showcase the Infor OS capabilities of Coleman and the API Gateway. So the API Gateway allows us to register and leverage APIs across our healthcare enterprise, whether you build your own internally or you register third-party APIs such as the Apple Health Kit, Fitbit, Fire, Uber Ride services, or maybe your own EMR's APIs. We can also ensure a standard security model such as OAuth 2 across all our APIs and control and monitor access to those APIs using the Infor API Gateway. Most importantly, we can orchestrate and chain APIs to complete and automate clinical workflows. Here I have built a workflow around scheduling an Uber ride for a patient. Our hospital patients have physical home addresses, so we will need to turn them into GPS coordinates. The second step of this workflow showcases that by calling the geocoding API from Google. We also have to define the possible GPS coordinates for all hospital locations for pickup, such as the emergency room, the main entrance, or a clinic. We do this through a lookup table here on step 3. And in the next to last step, we actually call the Uber Ride Estimate API with the information that we gathered along the way. The other notifications within this workflow would be used to present the information back to the user, such as a care coordinator if we were to run this from a desktop. However, using Infor Coleman, we can execute these workflows by building skills. So let's try it out. Coleman, are you ready?
Yes, Chad, I am ready to assist you.
Estimate Uber cost for patient 41177.
Please provide the hospital location.
Emergency room.
The estimated cost for the patient ride is $23 to $26. Would you like to schedule the ride?
Yes, schedule the ride.
Please provide me a phone number for ride status notification.
850-321-1462.
1 second while I get the confirmation. Okay, the driver's name is David. The ride is currently 4 minutes from arrival. I have texted 850-321-1462 the status of the ride.
Okay, so this is just the beginning of the possibilities with the API Gateway and Coleman to drive clinical workflows and better the patient and provider experience, as well as your care teams. And that concludes today's segment.